In this next question, you will have a graph to interpret and you'll be asked to explain what the graph might be representing. So the graph will be showing up on the screen and the interviewer will put this graph in front of you and say, can you describe this graph for me and tell me what it shows? Okay, so we'll jump into an example answer. So this graph is titled Antibiotic Resistance by Year. On the y-axis, it shows us the percentage of resistance, and on the x-axis, it is showing us the year that the sample was taken in. And then on the side, we've got lines showing us, or different colours showing us the different types of antibiotics that each line represents. So the lowest line, the line that shows the lowest level of resistance, is levofloxacin. So in 2009, it starts at 20% and then it increases to about 30% or 32% in 2014, and then for erythromycin it starts at about 70% in 2009, maybe 69%, and then it comes down to about 60% in 2014, and for clindamycin it starts at about 50% and increases to about 58% in 2014. So this graph is telling us that both clindamycin and levofloxacin levels are increasing in their resistance over time. And this would fit in with the general trend in antibiotics resistance, which we hear is increasing year on year. The implications for this in terms of healthcare are that there will be more difficulty in treating infections, and more infections will become resistant to more antibiotics. It will make treatment options a lot more difficult for doctors in the future. So the steps that we would want to do to improve this situation would be to be more selective about the cases where we use our antibiotics, to make sure that we have firm microbiological samples to act on before we give our antibiotics, or to make sure that we're following the appropriate guidelines for the prescriptions of antibiotics. We can also improve infection control measures, such as simply washing our hands, and we can also try to work on drug discovery. So the rate of antibiotic discovery rates has decreased over the last 20 to 25 years, at least compared to the sort of 50 years before then. So if we are ideally able to discover new antibiotics, that can help offer some new treatments for patients over time.